First Minister, much talk among scientists that we're moving from the pandemic stage to the endemic stage. What's your assessment?
I think we're on that journey. I don't think the scientific evidence and the data would say that we are yet in a position where the pandemic has become endemic, but hopefully that will happen in the not too distant future. There will always be significant uncertainties around COVID, not least, as we know from hard, bitter experience in recent months, the prospect of new variants. So we will have to be on our guard. I think the perhaps more legitimate question that we all face and are grappling with is how do we learn to live with COVID? And that's one the Scottish Government is thinking very carefully about. We plan to publish an updated strategic framework over the next few weeks. Now, sometimes when you hear people talk about learning to live with COVID, what seems to be suggested is that one morning we'll wake up and not have to worry about it anymore and not have to do anything to try to contain and control it. That's not what I mean when I say learning to live with it. Instead, what we will have to ask ourselves is what adaptations to pre-pandemic life, face coverings, for example, might be required in the longer term to enable us to live with it with far fewer protective measures. And of course, we've already got far fewer protective measures in place than we did at the earlier stages of the pandemic. So, we are in a position where we all want to get back to as much normality as possible. All of us, me included, really crave that. But we need to recognise that this virus, although we hope Omicron is milder than previous variants, this virus still takes lives and it still causes significant health impacts for people. So we've got to treat it seriously and not underestimate the damage that it can do.
You're making a statement to the Scottish Parliament tomorrow. It's understood that MSPs need to hear the detail of that first. But can we anticipate any significant change?
Well, the current protective measures that have been in place since before Christmas are in place. We have always expected until the 17th of January, which is, of course, next week. Now, I will set out tomorrow, and obviously Cabinet has to take decisions on this tomorrow morning, and I have to set this out to Parliament. But we'll look ahead and try to set out as clearly as we can what the expectations are over the remainder of this month. Obviously, I'll also share with Parliament tomorrow our assessment of the data as it stands. And, while we look at that every day, we look at that particularly closely at the start of weeks ahead of these statements I give to Parliament on a Tuesday. We're still in a very, very challenging situation with Omicron, as many, many countries across the world are. That challenge is particularly acute for the National Health Service. But I'd say two things in addition to that, and I'll flesh this out hopefully to Parliament tomorrow. Firstly, but for the protective measures we introduced before Christmas and but for the very responsible behaviour of the public, I think we would be in an even more challenging situation right now than we are, and some of our projections pre-Christmas have not quite come to pass because we've managed, I think, to mitigate to some extent what the Omicron wave would otherwise have presented for us.
On that point, First Minister, on that point though, if we're following the same scientific advice as the UK, for example, why is Scotland always, it seems, one step different? Is it simply to be one step different?
Can I come back to that in a second, if you don't mind, because it's important. I'll complete the point I was making, which is the second thing that I hopefully will be able to give a bit more detail around tomorrow, and I will caveat this quite heavily right now, but I hope that we might be starting to see some signs of improvement in the current situation, at the very least a slowing down of the rates of increase in hospital admissions that we've been seeing in recent weeks. So challenging situation, but one that could be worse had we not taken the action we took, but also one that I hope we are starting to see signs of improvement in. Coming back to your question, John, I don't take decisions to be different from anybody. There are, I was going to say a few things. There's nothing in my time as First Minister so far that has felt a heavier weight of responsibility on my shoulders than dealing with the COVID pandemic over the past 2 years. We consider all of the decisions we make very carefully.
On that point, what is the evidential basis for tougher restrictions? It's certainly in terms of figures, England seems to be broadly the same as Scotland over the piece. Why tougher restrictions here? What's the evidential basis for that?
On the comparison with England, if you look at the PCR daily test results, which I say I think we have to be very careful about relying on right now because of the changes in testing. If you look at the most recent day, it would suggest that cases in Scotland are falling faster than in England. But what I was going to come on to say is there are, I think the most reliable indicators that we can look at right now are twofold. Firstly, the Office of National Statistics weekly survey. Now we'll see what that says this week. Last week it said that around 1 in 20 people in Scotland had COVID versus 1 in 15 in England, which is a 30% lower level of infection in Scotland. But secondly, if we look at numbers in hospital right now, the most up-to-date figures would suggest that we have about 15% fewer people in hospital, proportionately, obviously, than in England. So I think that suggests that the actions that we are taking have been necessary. When we have rising case rates, we know the kind of things we need to do to try to stem those increases. It's about restricting crowded environments, about limiting the ways in which people come together.
But on that particular point then, you have the comparison of football grounds being limited to a crowd of 500, no limits on shopping centres, which are indoors. Again, what's the evidential basis for that?
Well, again, I set that out quite clearly when I introduced that. So we know that people coming together at big events, it's not just about, particularly with Omicron, and this is an important point, some of the evidence suggests that these big events can potentially be super spreading events. But it's also about when you have a big event with tens of thousands of people in the one place at the one time, the travelling to these events also increases the risk of infection because people are, perhaps sharing cars on trains and buses more than they would otherwise be.
Shopping centres as well.
But thirdly, you don't tend to have tens of thousands of people in the same shopping centre at the same time in the way you would in a football or a rugby stadium, for example. But big events also put a pressure on our emergency services. So a big football match demands police time, it demands the time of ambulance services, for example. Now, these services, because of the wider impacts of the virus, are already under significant pressure. So that was another reason for a period limiting these events. We don't want these things to be in place for any longer than necessary, which is why we will be looking at how we can start, I hope, in the not too distant future to lift these protective measures and get these kinds of things back to normal.
Over the past 5 years, the number of hospital beds have fallen by more than 2,000. Do you regret that your government oversaw that, given the situation we're in now?
Look, you can't manage a health service in normal times at the capacity that you need for a pandemic, but I think the experience of the pandemic, and this is partly what I mean by what do we need to do to live with COVID. We need to think afresh the appropriate capacities for health services and also how we treat people. But overall, I mean, hospital beds, acute hospital beds, not just in Scotland, but certainly across the UK and probably much of the rest of the world, have been on a downward path for many, many years as different procedures require shorter stays in hospital.
On education, is it fair to leave teachers and pupils in limbo until possibly knowing whether they're going to be sitting exams this year, possibly as late as March?
No, it wouldn't be fair, but that's not what we're doing. The decision has been taken. As of now, exams are going ahead, and that is the clarity that has been given. We are still in a pandemic of an infectious virus, though, so it would be deeply irresponsible not to say that we had contingency measures in case, for example, we have another variant and I really hope this doesn't happen, that disrupts children's education. But no responsible leader would, in the face of what we're dealing with right now, say anything other than we've got to have contingencies should the unexpected happen.
Okay, but given that, you spoke about disruption. That disruption perhaps hasn't been equal across the country. Different places have been affected more. Is it even possible to run a fair diet of exams under those conditions?
The Education Secretary has set this out already, the circumstances in which we took that decision. One of the things that has been made very clear, of course, is that if there is any further disruption, which we don't want to children's education, then additional support will be essential.
Looking ahead to the government agenda for the year to come, you promised at the SNP conference in the autumn that you would reboot the independence campaign this spring. If COVID persists, and it very possibly might, does that mean that you can't commit to another referendum in 2023?
Look, my plans haven't changed from what I set out at the end of last year, which is, and remember, it's not yet a year since my party overwhelmingly won an election on the basis of this prospectus, that I want to give the people of Scotland the opportunity to choose independence before the end of 2023. We will take the steps this year, both in terms of the practical preparations, but also the substantive case on independence to enable that to happen.
So that would include an independence referendum bill at Holyrood. When might that be introduced then?
I'm not going to give you a date for that because we haven't taken the decision on that, but what I will say, and I'm not saying anything I haven't said before, is that we intend to do that in a timescale that enables the commitment that we won the election to have a referendum before the end of 2023 to happen. Just
to allow that to happen then, so this might have to be, some people would predict, say, the bill would need to come before Holyrood before Easter, because it may take some time for that to pass through Holyrood, possibly into next year. There's the likelihood of a court challenge to it, and that all pushes your timetable back.
Well, look, I'm not in I hope there won't be a court challenge to it, but I'm not in charge of that. The UK government will have to.
But it is a possibility, so that would push your timetable back.
What I can say to you right now is that I intend to do everything that is within my power to enable that referendum to happen before the end of 2023, and we will set out exactly what that means in terms of the date of introduction of legislation when we've taken the detailed decisions around that. But more importantly, well, it's not more importantly because obviously the enabling the referendum is important, but actually what I think is much more exciting as we come out, I hope, of the pandemic, and certainly the acute phase of the pandemic, are the opportunities that come with Scotland being independent, so that we're not having in future to suffer what we've suffered over the past couple of years of being taken out of Europe against our will, of having all of the implications of that, of being governed by Boris Johnson and his band of Brexiteers, but instead being able to choose our own path and our own destiny as a country. I think that's thoroughly positive, and I think that kind of debate is quite energising as we come out of a global pandemic. And
that debate will be for whatever happens for later in the year. The gender recognition. The Gender Recognition Reform Act has caused significant division in your party, in your government indeed. Are you likely to offer a free vote on that when it comes to Holyrood?
Well, that would be a decision for my parliamentary group, and they will decide that in due course. The plans, again, these were plans in our manifesto at the election last year, the election that we won overwhelmingly, and we'll set out the timetable for that legislation in the very near future. This is about not whether or not somebody should be able to legally change gender. That can happen already. This is about trying to ensure there is a process that allows that to happen, that does not stigmatise, that does not traumatise trans people, and that is much more dignified and respectful of their rights. And I think that is something everybody should be very much of the view is a good thing to do. But of course there are debates to be had as we go through the legislative process.
Do you think the Scottish public will agree with you on that?
Well, actually, the Scottish public overwhelmingly re-elected the government on this manifesto commitment. I think much of polling evidence around this suggests that there is not the opposition amongst the Scottish public to this, as some may suggest there is.
Very finally, First Minister, it's your first major interview of 2022. What's your resolutions for the year ahead?
My resolution is to keep every single day doing the job of First Minister to the very best of my abilities, to give it all of my energy, all of my commitment, and to serve the people of Scotland to the very, very best of my ability, to lead us as well as I can through the remainder of this really challenging situation with COVID, and then to offer the people of Scotland the chance of a better, brighter future, which I believe comes with us being a normal, independent country.
First Minister, thanks for joining us in Scotland tonight.
Thank you.